Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
Millions of Americans are hitting the roads or hopping on a plane to visit family and friends during the holidays. But with those long journeys often come certain health concerns. We highlight one of them in today's Your Health.
Whether you're traveling by air, bus, or car during the holidays, those long journeys are thought to cause a slightly increased risk of deep vein thrombosis. DVT is where blood cells clump together and form a clot in one of the deep veins of the body.
One of the things when we travel is we don't tend to be moving as much. Blood likes to move and stay in constant motion. When it stands still, it actually forms clots.
Some doctors say the risk of deep vein thrombosis doubles after a long-haul flight or car ride. But according to Dr. Morgan Sauer, there are ways to reduce the risk. If you're in a car, pull over every few hours and take a short walk. If you can't get up and walk around, at least stretch your legs, moving your feet up and down.
That'll help cause the muscles in the calves to do a pumping action, and that massages the deep veins of the calves, which is where we get most of our clots.
Also recommended, taking an aspirin a few days before your trip.
Taking an adult aspirin 1, 2, or 3 days before your trip can be helpful to keep things from sticking together.
3 symptoms to look out for: redness, pain, and increased size of your calf. If you experience these after a long trip, see your doctor.
If you do have a deep vein thrombosis, you will be put on anticoagulants or medications that actually thin the blood.
And if you are overweight, doctors say you are at an increased risk for DVT, so it's especially important to take those steps to help.